everyone, my name's Arrow. I go by they, them pronouns, and this is my chest, 2 weeks post-op. In the last few days, because the last one that I filmed was 8 days post-op, so in the last little bit, I've been doing a lot better. I've been regaining some more energy. I've been still kind of getting tired quicker, but I've been more okay. The itchiness started to fade after I was able to shower more, which was really nice. I still had a lot of weird sensations though, like just like pressure or feeling like my chest is like wet, and stuff like that. Yeah, and then the last couple days I've been experiencing more pain. So like here will like ache, which sucks. And then my nipples, especially my right nipple, will like burn or like kind of sting. And I had some weird nightmares. I don't usually dream, but I guess I've started doing that more. But I had some weird nightmares about like my nipples falling off, and I think that even if they did, like it wouldn't be that horrible, but they were pretty, like I was just like woke up feeling so awful. So that was fun. But like, no, I'm really happy with my chest so far. My nipples are starting to actually really heal. You can see like some of the skin and the corners are like actually starting to look nicer, which is really cool. And yeah, I'm really starting to feel more in tune with my chest. Like it just feels more like real that it happened for sure now. Although I did have one moment where like I looked in the mirror with my ace bandage on, because I wear my ace bandage all the time, by the way, except for this and when I'm showering. But and I was like, wow, that's a really great binder. And then I was like, wait, I'm not binding, and it's great. Under the ace bandage, I have little pads that I put on my nipples, and then I put on the ace bandage. I have put polysporin on this as well. Normally I use the non-stick pads because they're the most easy for me, and it's like super nice and they don't move around at all, and they don't stick. But I've started to use these like gauze cotton pads because we ran out of the non-stick. I'm hoping to get more soon. My mobility is pretty good. I can lift things. Again, I'm not allowed to lift anything over 10 pounds until 6 weeks. I've been started to apply some polysporin and aloe vera to my scars, or to my incisions. They're mostly closed. There's a couple spots where like they're not, they kind of get dry, which has been the aloe vera is helping. I only did that the last couple days. And there's like a couple spots where there's still kind of scabs, but mostly it's closed. I did find out I had steri strips on it, and when I got the nipple dressings removed, I was supposed to leave the steri strips on until they fell off naturally. I didn't do that. So, but they're looking fine. And any sort of pulling here is starting to look better. But yeah, there was some issues over here, where it wasn't closed, and there was like a stitch sticking out, and it was really painful. Like it wasn't really painful, but it was hard. Like it hurt. It still kind of hurts to touch, but it was uncomfortable. It was really bothering me. So I ended up putting 2 steri strips there. This one's kind of come off, I guess, and then there's just this one that's still there, but we tried to apply some polysporin to that too, but there was the stitch poking out there. I think it's starting to go into the skin and starting to actually close because it wasn't closed there. I do have a lot of sensation around here, and then around my scar, for the most part, it's pretty numb. Like on my scar, like I feel it still. Like I feel it. There's like it's touching there, but it feels like weird. Like it doesn't feel like skin normally does. It kind of feels like when your lip gets numb, and then it just like you still feel it, but like it just feels different. So there's that. The scar is definitely thicker on this side. Like it's you press down and it like feels hard. And I'm just really trying to massage those out. It's no longer painful to do this. The bruising's really gone down and swelling. I'm still trying to ice it, at least like twice a day. And yeah, there's some stitches poking out of my nipple, and on this one still. But like, yeah, and the rash has been going down a little bit. It's still here, but I was prescribed a rash cream by my doctor, to help this. And so I think that's helped it from like, that's stopped it from itching, but it still kind of has been present. I started putting acne medication on it last night. I use a benzoyl peroxide, benzocaine for my face. So I started using that on this, and so I'm hoping that'll help maybe. Because yeah, I just don't really want it there, and I don't want it to like scar, so we'll see. But yeah, and then I've just been feeling really good, so I decided to go back to school today, and I wasn't sure if I was going to be able to do a half or whole day, and there was some issues with my car, so I had to go into the shop, so then I ended up driving it because I had to pick it up. So I ended up driving today. That was fine. And I'm going to school today, and I was just going to go for a half day, but I ended up going for a full day, and that was fine. And then I drove home about like 45 minutes. So yeah, so I've been fine to drive, been fine to be at school, and I was nervous about going to school not completing the work that I was given to work on during my recovery, because I came back early. I was supposed to wait a couple more weeks before coming back, but I've been feeling fine, so I didn't need to. But it was fine. The teachers just said to like work on that stuff during class or at home, and just like take it easy, and I have other assignments that I will be exempt from, so I can kind of work on my own stuff, and just really what I can do it kind of thing. But yeah, so that's how things have been going, and I'm just really excited. It's turning out really, really well, and yeah, my belly hair is starting to grow back. Yeah. All right, well, oh, and another thing I do want to mention is something that's been helpful to me is I can't have the water touch my front when I'm showering. So sometimes, you know, get to your belly or like your back, but it's hard to sometimes clean my armpits or like my chest, and I want to clean it as much as I can. So like I have the alcohol-free soap, so I kind of, you know, bubble it up and then put it on, not touching my nipples directly because I don't want to damage them, but I can use like a plastic cup that I have from our Magic Bullet blender, and so I have been filling that up in the shower, and then have been pouring that over myself, and I find that really helpful. I also just wanted to mention that I had a follow-up with the clinic. They emailed me at about 10 days, and I sent an email to them back about all the different things about how my chest was healing, and I sent pictures in. Also, I was supposed to have drains in, and I didn't find out that I was not supposed to have drains in until the day of surgery. I just haven't mentioned that.
And now for an up-close shot.
All right, that is all. I hope you have a lovely day. Okay.